that the numbers are still heightened, that we're in the midst of a second surge.
We're seeing the rates just increase on each level, not only daily cases, but in that hospitalizations, and that is concerning.
Bell and McLennan County Public Health Districts are both still seeing a big increase in COVID-19 cases and an increase in patients ending up in the hospital. COVID data shows a steady uptick in cases since Halloween, but health officials expect to see another influx next week, partly because of Thanksgiving. 25 News reporter Leah McNeil is here with more. Leah?
Well, Todd, it normally takes between 7 to 10 days to start seeing those symptoms if you have been exposed to COVID-19. Since it's now 8 days after Thanksgiving, health experts say they expect to see an increase in cases throughout our area over the next week.
We're still in the midst of a surge, but we will see what happens by the end of the weekend and into the early part of next week in response to Thanksgiving.
As those Thanksgiving leftovers disappear, health officials say it's clear COVID cases continue to climb.
Well, the concern, of course, is that our cases will start to grow exponentially.
Over in McLennan County, their daily case counts have consistently stayed over 100. The hospitalization rates remaining over 15% capacity, prompting them to get a portable morgue.
Due to our high number of cases, our hospitalization rate being so high and over that 15%, we wanted to have this in place before we needed it.
We are seeing what could be the start of an increase, but it's a little early to say.
But over here in Bell County, cases and hospitalizations appear to have leveled out over the past few days. But on Thursday, there was a jump in cases, with Temple and Belton area hospitals seeing more stress than Killeen and Harker Heights area hospitals, and Thanksgiving cases expected to roll in any day now. Officials out here are concerned.
And I'm hearing that there's more stress on the eastern side of Bell County in, those facilities than there are on the western side of the county. I can't speak to why that might be the case, other than, of course, the rates on the eastern side are higher. We've been seeing that pretty consistently throughout.
Although we are in our 10th month of coronavirus restrictions and a vaccine on the way, officials still urge everyone to heed their warnings before it's too late.
How well we fare depends on every individual's own choices. If we have enough people listening to these warnings and taking heed the way we're asking them to do, we'll get through it.
Overall, they tell me hospitals are busy, but they aren't overwhelmed. There are surge plans in place in both Bell and McLennan counties just in case. Reporting in Killeen, Leah McNeil, 25 News.